Hello, and welcome to the Reproductive Health Program Enrollment Form Training for RH Program Clinics. My name is Allison Babbage, and I'm the Reproductive Health Provider Liaison. This video is meant to help clinic staff at RH Program Clinics navigate the RH Program Enrollment Form. To give staff a full understanding of how we use the information provided on the enrollment form, I'll start by going over our different clinic types. Then, I'll go over each section of the enrollment form, including the eligibility section, the demographics section, and the staff page. And I'll finish by showing the client enrollment webpage where you can find more resources. Before we get started, this table lists a few documents that might be helpful to have in front of you as you watch this video. They can all be found on our client enrollment webpage, which is healthorg.org/RH client enrollment. Feel free to pause the video at this point and get these documents before moving forward. I also want to point out that throughout these slides you will see orange links. Unfortunately, they aren't clickable in the video, but they are in the slides themselves. And you can find the slides on our training page, which is healthorg.org/RH trainings. Okay, so let's get started. As you'll remember from the orientation, we get funding from 3 different sources: CCARE, REA, and Reproductive Health State General Funds. Each cover slightly different services and have different eligibility requirements. And we have 2 different clinic types, CCARE only and RH program. We've tried to set up our system so that clinic staff do not need to worry about the individual funding streams. Instead, we want clinic staff to focus on enrolling eligible clients, providing services, and getting reimbursed. So instead of going through the details of each funding source, I'll give a brief explanation of what services each clinic type can get reimbursed for and what makes a client eligible at each clinic type. Clinics that are CCARE only can get reimbursed for contraceptive services provided to clients enrolled in RH program coverage. And to get these services covered at CCARE only clinics, clients must be able to get pregnant or get someone else pregnant, be at or below 250% of the federal poverty level, be an Oregon resident, and either have U.S. citizenship or what we call eligible immigration status. Clinics that are certified as RH program clinics can get reimbursed for reproductive health services provided to clients enrolled in RH program coverage. To get these services covered at RH program clinics, clients must be able to get pregnant or get someone else pregnant and be at or below 250% of the federal poverty level. They do not need to be an Oregon resident, and they can either have U.S. citizenship, eligible immigration status, or another immigration status. Now, I recognize that the terms eligible immigration status and another immigration status mean nothing to most people, but I will explain them later in the video. No matter what type of clinic the client is visiting, the enrollment form assesses the client's eligibility for all 3 funding streams. At CCARE only clinics, clients may enroll into coverage, but not be able to get all of their services covered at that clinic. At RH program clinics, on the other hand, there are only 3 circumstances that make a client ineligible to get their services covered by the RH program. Clients are only ineligible if they are unable to get pregnant or get someone else pregnant, or if they are over 250% of the federal poverty level, or if they are enrolled in OHP. With that said, as a RH program clinic, you are required to provide the same services and supplies to all clients seeking reproductive health services, regardless of who is paying. This means all clients must get their contraceptive of choice at their appointment without having to go to a pharmacy, and they must get the same counseling and health screenings.
Essentially, you should treat everyone seeking reproductive health services as if they enrolled into RH program coverage.
Now, before we get into the details of the enrollment form, I want to take you on a slight tangent that will hopefully explain why enrollment for clients who mark eligible immigration status looks a little different than it used to. At the end of January, the Supreme Court ruled that an expansion of the public charge rule could take effect. This means that for some immigrants, receiving certain health care benefits from the federal government could make it harder for them to get a green card. In order to protect these clients, we started using a different funding stream for clients who mark eligible immigration status on the enrollment form. This means that we only verify the income and citizenship of clients who indicate that they live in Oregon and are a U.S. citizen. If a client indicates that they have either eligible immigration status or another immigration status, their information stays within the RH program and is not shared with federal agencies. For more information on public charge, we recommend going to the Protecting Immigrant Families and/or the OHA public charge webpage. Okay, it's finally enrollment form time. The enrollment form is available on our client enrollment webpage in English, Spanish, Korean, Marshallese, Russian, Simplified Chinese, and Vietnamese. And it essentially has three sections: the eligibility section, the demographics section, and the staff page. Let's start by going over the eligibility section, which takes up the first 3 pages. The questions in this section do 2 things. They either determine a client's eligibility for RH program coverage and/or they determine what funding stream we should use for the client services. The first thing we ask for is the client's legal name. This is their name as it appears on documents like their driver's license. The reason we need the client's legal name is because the client's name is one piece of information we use to verify the income and citizenship of clients who mark U.S. citizen on the enrollment form. For example, if you have a client whose legal name is Abigail, but she writes Abby, we won't be able to verify her information. Then we ask for the client's address. This is where the client would like to get mail. If they are houseless or worried about confidentiality, they can put the clinic's address. And if they don't live in Oregon, they just need to provide their city and zip. Next is date of birth. This is to make sure the client is within the age range of being able to get pregnant or get someone else pregnant. We also use it to verify the income and citizenship of clients who mark U.S. citizen on the enrollment form. Please ask the client to use the U.S. convention of month, day, and year. We then give clients the option of listing their age and gender identity. These 2 fields are not required, nor are they in the eligibility database. We added the field for age because, as you'll see later, a person's immigration status may change depending on their age. And we added the gender identity field because we wanted to allow clients to be able to self-identify. Next, we ask for the client's sex assigned at birth. This is the client's sex as was marked on their birth certificate. We need this to determine the correct funding source for the client services because, as you may remember from the orientation, one of our funding streams can only be used for clients who are female-bodied. Then we come to questions 4 and 5, which ask about the client's reproductive capacity. All of our funding streams require that the client either be able to get pregnant or get someone else pregnant. So if a client is postmenopausal or has been sterilized, they are not eligible for the RH program.
To be honest, we struggled with how to word these questions in a way that was both medically accurate and low literacy. Since we've rolled out the enrollment form, we've received suggestions for more understandable wording and will definitely incorporate them in our next version of the enrollment form. But for now, just be sure to review these questions with the client to ensure that they answered them correctly, because if they checked yes to either, they are not eligible for the RH program. Question 4 asks if the client is postmenopausal. A client should check yes if they have stopped having a period due to menopause. If they are 45 or older and still getting their period, or if they stopped getting it because of contraceptives or other medical reasons, they should check no. And they should check not applicable if they are male-bodied or younger than 45. Question 5 asks if the client has been sterilized for more than 6 months. They should only check yes if they've had a medical procedure that prevents them from getting pregnant or getting someone else pregnant. Next, we come to questions 6 and 7.
It is super important to know and let clients know that none of the answers to these questions make them ineligible. They can still get free services no matter how they answer. These questions are just used to determine the correct funding stream to use for their services. Question 6 asks about citizenship and immigration status. The only reason we ask this is because our funding streams have different requirements. For example, CCARE, the funding source we try to use the most often, requires that the client has U.S. citizenship or eligible immigration status. REA requires that the client have another immigration status, and the Reproductive Health General Funds don't have any citizenship or immigration status requirements, but it is our smallest pot of money.
So let's talk about what these terms mean. A person is a U.S. citizen if they were born in the U.S., Puerto Rico, Guam, or the Virgin Islands. Now, I don't know about you, but I sure don't remember my high school geography lessons, and I wanted to know where Guam and the Virgin Islands are, so I looked them up. And as you can see, Guam is over by Indonesia, and the U.S. Virgin Islands are near Puerto Rico. A person is also a U.S. citizen if they've been naturalized or gained citizenship through the Child Citizenship Act of 2000, or if they were born outside the U.S. to a U.S. citizen. A person is a U.S. national if they were born in the American Samoa or Commonwealth of Northern Mariana Islands, which are circled in blue. Then we come to eligible immigration status, which means an immigration status that is eligible for Medicaid. This includes refugees and asylees, and folks with work or student visas if they are younger than 19, and folks with lawful permanent resident status if they are younger than 19 or 19 or older and have had LPR status for 5 or more years. Then another immigration status means an immigration status that is not eligible for Medicaid. This includes folks with DACA, folks who are undocumented, or folks who have work or student visas if they are 19 or older, and folks with lawful permanent resident status if they are 19 or older and have had LPR status for less than 5 years. As you can see, determining whether a client has an immigration status that puts them in the eligible immigration status category or the another immigration status category is not cut and dry. It is actually super confusing. So to help both clients and clinic staff, we created this citizen and immigration status chart. It is available on our client enrollment webpage in all the same languages as the enrollment form, and we highly encourage staff to use this chart to ensure that clients have answered the question accurately. And if after looking at the chart, a client still doesn't know how to answer, we have guidance on how to help the client. This is also available on our client enrollment webpage. Next, we ask for the client's Social Security number.
This is another piece of information we use to verify clients' income and U.S. citizenship. If a client who marked U.S. citizen does not know their SSN, don't panic. We will still reimburse for their services. Just ask them to call with their SSN when they can. And if they were born in Oregon, encourage them to complete the Oregon Birth Information Form found in our Tools table on the Client Enrollment webpage so that state staff can verify their citizenship using the Oregon Birth Record Database. And please note that clients who mark eligible immigration status or another immigration status do not need to provide an SSN to get a full year of coverage. This is because the funding we use for their services does not require an SSN. At the top of page 2, we ask whether the client has OHP. This is another question that can determine a client's eligibility for RH program coverage. If you remember, a client does not qualify for RH program coverage if they have full OHP. However, all reproductive health clients must be treated the same, no matter who pays for their services. So if a client checks yes, you must provide them the same services, you just bill OHP instead of us. If a client checks yes, but just for emergencies or pregnancy, they may still qualify for RH program coverage because COWM and COWM Plus are not full OHP. Note that if a client checked that they have COWM or COWM Plus, they should also have checked that they have another immigration status, as COWM and COWM Plus are only available to clients with another immigration status. If a client checked no, they may be eligible for RH program coverage. But if the client checked I don't know, you should look them up in MMIS because claims submitted for clients with OHP will be rejected. Questions 9 and 10 ask if a client has any other health insurance and whether they need confidentiality for their reproductive health services. These questions are asked for billing purposes. Clients can still qualify for RH program coverage if they have private insurance or Medicare. The reason we ask is because we must be the payer of last resort. However, if a client indicates that they need confidentiality, do not bill their insurance, just bill us. The next two questions ask for the client's household size and income. This is to determine the client's income in relation to the federal poverty level. Let's start with household size. Just like OHP, we measure household size based on tax filings. Now, we know that many clients do not know this information. They may not even know what a tax filing is. The first thing to do is to assure them that this information is self-declared, meaning we don't look it up. Then just try to help them figure it out. To help with this question, we created this flowchart, which is available on our client enrollment webpage. It starts by asking if the client filed taxes last year. If they did, they need to include anyone they claimed on their taxes, like a spouse or children. For example, say a client has 2 children, both of whom they claimed on their taxes. Their household size would be 3, themselves and their 2 children. If the client did not file taxes last year, ask if anyone else could have claimed them, like a parent. If the answer is no, their household size is 1. If the answer is yes, they must include themselves, the person who filed the taxes, and anyone else they think would have been on the taxes, like siblings or another parent. So taking one of the children from the first example, their household size would also be 3, themselves, their parent, and their sibling. We know this is kind of convoluted, so clients should really just put their best guess.
Like I said before, we do not verify this information, and if the client really doesn't know, they can just put 1. Then we move on to income. In this section, we only want the client's income, not their parents, not their spouses, just the client's. Our enrollment form guide lists what counts as income and can be found on our client enrollment webpage. The final question in the eligibility section of the enrollment form is about voter registration. Federal law requires that we offer clients the chance to register to vote. This means all clinics should keep voter registration cards available for clients who check yes to this question. If a client checks yes, you should give them a voter registration card and offer to help the client fill it out and mail it, though they can take it and do it themselves. If the client checks no, no other action is required. And the option NA is for clients who are already registered or ineligible to register. And the last part of the eligibility section is the 3rd page, where we have the Social Security number statement and the client signature. The Social Security statement tells clients why we ask for their Social Security number, and the client must sign and date the enrollment form. Even if a client completed the rest of the enrollment form, if they haven't signed and correctly dated the form, we cannot pay for their services, nor can you bill the client. So it's super important to check this field before they leave the clinic. And that covers the eligibility questions. Next are the demographic questions. None of these questions have anything to do with eligibility in the RH program. Their purpose is to help us reduce health disparities and ensure that folks receiving services are treated equitably. Clients should answer these questions however they want. Almost all the questions have a decline to answer option if they're uncomfortable answering, and they are also the last questions the clients must answer. Okay, now that the client is done with the enrollment form, they will hand it in, at which point it is super important that you check it. There are some questions that can determine a client ineligible outright, and others that are just confusing. You should also check for completeness. If an enrollment form isn't complete, the client can't be enrolled for RH program coverage. To help with this, we created an enrollment form quick check guide, which, surprise, surprise, can be found on our client enrollment webpage. It goes over the most important questions to review. If a client checked yes to question 4 or 5, they are not eligible for the RH program. Clients must either be able to get pregnant or get someone else pregnant. If a client checked yes to question 8, they are not eligible for RH program coverage, but they must still be provided services. Questions 6 and 11 and 12 are the most complicated, and you should check with the client to ensure that they answered correctly. And finally, if the client has not signed and correctly dated the enrollment form, the services they received that day will not be reimbursed and you won't be able to bill the client. The last page in the enrollment form is just for staff. Let's go through the top portion first. First, we need the agency and clinic's AILRS numbers, and then the date that you are reviewing the form. Next, we ask for the name of the staff person who is going over the form with the client. This is in case there are questions about the form during an audit. Then we ask for the client's RH program number, which is the number assigned to the client after their information is saved in the eligibility database. Next, we ask for the client's FPL. To be eligible for the RH program coverage, their individual income must be 250% or below the federal poverty level. If they are above that, you must still provide them services, but you may charge them based on your normal clinic practice. Next are checkboxes to ensure that staff are following our customer care requirements. Staff must offer all clients the OHA Notice of Privacy Practices. Clients do not need to take them, but they must be given the opportunity. The Notice of Privacy Practices are available in several languages, and we have links to them on our client enrollment webpage. Staff should also explain what types of services are covered by the RH program and discuss payment options for any services they may get that are not covered. Staff should also provide the client information on where they can get primary care if needed and where they can enroll in health insurance if needed. Now I'll go over the rest of the page, which is only relevant if the client marked you as a citizen. The first part is to ensure that clients who answered yes to the voter registration question receive a voter registration card. The rest of the page is just a tool to track how citizenship and identity are verified for clients who mark you as citizen. If staff choose to use this section to track how client citizenship was or will be verified, they will see three options. The first is that the client brought in some kind of documentation like a passport or a birth certificate. Unfortunately, there are different instructions for birth certificates than for other documents like passports. If the document is not a birth certificate, make a copy and place it in the client's record. But if the document is a birth certificate, do not make a copy. Instead, enter its state file number in the eligibility database. The state file number is usually around 13 digits long and is sometimes called the birth certificate number. Unfortunately, its location on each birth certificate varies from state to state and sometimes year to year. I know there isn't a designated place to write this number on the enrollment form, but if you want, you can just write it on this page of the enrollment form. The reason we tell you not to make a copy of a birth certificate is because it's actually illegal. And the reason it's illegal is because birth certificates are just a piece of paper and are therefore easy to use to commit fraud. Other documents, on the other hand, are multiple pieces of paper or cards and are therefore much harder to use for fraudulent purposes. So remember not to make copies of birth certificates. The second box is to indicate that the client's citizenship will be verified using an electronic match process. Most client citizenship is verified through an electronic match process. The match process uses clients' names, social security number, and date of birth to verify citizenship, and it has a 92% success rate. This is especially helpful for clients who do not have access to their citizenship documentation. And it means most clients do not need to bring in proof of their citizenship. If you want more information on the electronic match process, see our client verification FAQs on our client enrollment webpage. The third box is for clients who are re-enrolling and have already had their citizenship or national status verified. You can find out if this is the case for a client by looking for them in the eligibility database. The next section was for clients who marked eligible immigration status. However, since we no longer require clients to provide proof of immigration status, you can just ignore this section. And the final section is for proof of identity. Many documents that prove citizenship also prove identity, but not all. For example, birth certificates do not prove identity. When this is the case, be sure to ask the client for a driver's license or school ID. Make a copy of the ID and place it in the client's record. We have a resource that lists the different documents that can be used to prove citizenship and identity, and it lists which can be used for both. It can be found on our client enrollment webpage. And that's the enrollment form.
But before we wrap up, there are a couple things I want to touch on. One is if a client declines to complete the enrollment form for whatever reason. Maybe they're worried about their immigration status. When this happens, we will not be able to pay for their services. However, you must still provide them the same high-quality services. You should be transparent about your fees and explain that if they provide their household size and income, it may reduce their fees. But you may not require proof of income. I also want to touch on a few workflow processes to take under consideration. Where will you keep the enrollment forms? Will you keep the paper forms? Will you scan them and put them in the client's EHR record? If you scan them, remember to scan both sides of the paper. When will you enter the enrollment forms into the eligibility database? When the client hands theirs in, once a week. And finally, I'd like to encourage you to give enough time for clients to complete the enrollment form and staff to review it for accuracy. The form is not short, and it can take time to go through all the pieces.
And remember our quick check guide. Finally, I want to leave you with where you can find our resources and tools for client enrollment. The web page is healthoregon.org/RH client enrollment, and that's one word. And that concludes this video. Thank you for listening, and if you have any questions, don't hesitate to reach out. Have a great day.